Now, once we have understood everything related to the anatomy of internal capsule in the form of relations, in the form of the parts, in the form of its arterial supply, in the form of the fibers which are crossing or passing through these regions of the internal capsule, now is the time to have the practical implications. I'll give you one question. Like 58-year-old man with long-standing hypertension presenting with the sudden onset weakness of right face, right arm and leg. So here what we are observing is that there is a pure motor deficit. That means there is involvement of the corticospinal fibers. Now, sensory examination is absolutely normal and there is no aphasia, there is no neglect, or there is no visual field defect, which means that there is no cortical sign. So there, this lesion can be associated, or this lesion can be thought of that it is a subcortical lesion. And you know, the subcortical region is the internal capsule, the brain stem, and so on. So CT of the brain reveals a small, deep infarct. Now, this small, deep infarct obviously goes in the favor of the lacuna stroke, as we are collaborating, or as we are trying to relate it with the clinical findings. Now, which of the following is the most likely site of and the artery involved? You know, lacuna, the corticospinal fibers are compactly located in the anterior part of the posterior limb. Now, if you see it over here, that the corticospinal fibers, they are located or they are compacted in the anterior part of the posterior limb, and this anterior part of the posterior limb is supplied by the lenticulostriate arteries. So, what is the correct answer for this particular question? Is the posterior limb of the internal capsule, that is anterior part, supplied by lenticulostriate artery. So that is the correct answer. Now, why not option A? Because the genu, it is responsible for mainly carrying the corticobulbar, that means the facial fibers, not the motor limb fibers alone. So that is the wrong answer. If you look at the option number C, where there is retrolenticular part, which is supplied by the anterior choroidal artery, you also know that retrolenticular lesions, they are responsible for producing visual defects. All right. So this is not as far as this question is concerned. And thalamus, you know, thalamic lesions cause pure sensory stroke, not the pure motor weakness, not the sort of pure motor weakness that we are observing in this particular question. So that is why the correct answer for this question is the posterior limb of the internal capsule, particularly the anterior part. And as you know that this anterior part of the internal capsule carries the corticospinal fibers and it is supplied by the lenticulostriate artery. So this is how you have to locate, after understanding the anatomy, that where exactly these lesions are, and you can answer these questions correctly.